Hi, my name is Peyton Balcone, and I got the opportunity to shadow a family medicine physician. His name was James Keck, and it was at the UK Healthcare Outpatient Clinic on Richmond Road. And it was very cool. I'd never been to a clinic like that before. It was very large, had all different kind of specialties for patients to see, and it was really neat. We saw a total of 6 patients. The first patient we saw had very normal vital signs. He was coming in for more of a checkup. So it was nice to see kind of a baseline patient and get to compare that to the rest of the patients we saw the rest of the day, because the next patient we saw, you could tell right away when we walked in the patient's room that he was in pain, and he had swelling all over. You could tell right away something was maybe going on with the kidneys, and it was just very abnormal. So I got to learn just how important those first few seconds are when you enter a patient's room. Just how important that general survey is and how much you can learn from that patient and what kind of state they're in. So that was really neat. I also got to see another patient that had a language barrier, so he spoke a different language, and with that they needed an interpretation. And they had this little device that you could roll in that had an iPad in that called an interpreter, and the physician had to speak through her and then have them relay that message to the patient and vice versa. So that was really neat because it obviously was very difficult because not everything translates well, and it's really hard to make sure that patient is comfortable. And so it was really cool to see the therapeutic techniques that the physician used. He maintained eye contact with the patient that whole time, as well as held him on the shoulder, made sure he approached when he went to assess his legs very gently and very cautiously. So that was really cool to see. We also got to see another patient who had a skin rash, and the physician came in, assessed the patient, and kind of said that he wasn't really sure exactly what this was, and so that he would love to get a second opinion. So I got to see a little bit of a collaboration because there was actually a dermatologist in the building down the hall a little bit. So we went to go find the dermatologist, we brought him back, and I got to see how that worked with when he wasn't sure and confident about what was going on, how he got a second opinion. And that was really cool because you got to bring someone in to be an advocate for his patients. That was awesome to see. And I also got to see a little bit of interaction with the nurse. So what the nurse's job in the clinic is to get the patient, do their vital signs, and then give a little bit of a handoff, which was like a little sheet of paper with the vital signs and a little general survey about that patient, hand it to the physician, and then the physician would go in. And so that was cool to see how they communicated, because the physician really relied on the nurse's ability to get a little bit of a general survey and vital signs, so the physician knew what he was going into when he entered the patient's room. So it's cool to see just how much the physician relied on the nurse and how knowledgeable the nurse was about specific topics that was going on with that patient. So that was cool. And overall, I just really enjoyed my experience, and it was really cool to see the clinic. I've never been to a clinic before, so I liked seeing just how it worked and seeing the physician really talk about with all his patients just more about diet and exercise and just overall how to keep them healthy, and that was really awesome to see. So thanks.